Hello, we are entering Chapter 21, Nutritional Support and IV Therapy. You will, of course, go over the objectives, know the terms, and know the abbreviations, know the skills that's associated with this chapter. And remember, you must read, write your notes, and take your notes and review and study so you can pass it with a 70% or greater. We are going to go ahead and bypass the contents. It is on your handout. Reasons for nutritional support. Many persons cannot eat or drink because of illness, surgery, or injury, chewing or swallowing problems, refusal to eat or drink, inability to eat enough to meet nutritional needs. Food cannot pass from the mouth into the stomach or small intestines. Nutritional support or intravenous IV therapy ordered by the doctor to meet food and fluid needs. Poor nutrition results when residents cannot ingest enough food or fluid. Aspiration is a risk. Aspiration is breathing fluid, food, vomiting, or an object into the lungs. Common causes are cancer, especially cancer of the head, neck, and esophagus, trauma to the face, mouth, head, or neck, or coma, dysphagia, dementia, eating disorders, nervous system disorders. See Chapter 33 for that. Prolonged vomiting, major trauma or surgery, acquired autodeficiency disorder, and illnesses and disorders affecting eating and nutrition. You have your enteral nutrition. Enteral nutrition is giving nutrients into the gastrointestinal tract through a feeding tube. There are different types of tubes. You have your nasogastric NG tube, nasal enteral tube, which consists of two different kinds, a nasoduodenal tube and nasojejunal tube. Gastrostomy tube is for the stomach tube, jejuostomy tube, and the percutaneous endoscopic gastrostomy PEG tube. Percutaneous endoscopic gastrostomy PEG tube. Gavage is the process of giving a tube feeding. Tube feedings replace or supplement normal nutrition. NG, figure 21, and nasal enteral tubes, figure 21-2, are used for short-term nutritional support, usually less than 6 weeks. You'll have, the picture shows you that the nasogastric NG tube is on the left, and you see where the tube goes into the stomach. And the nasal enteral tube goes all the way down and goes into the small intestine. Gastrostomy tube is placed in the stomach, and you see the gastrostomy tube, and then the jejuostomy tube is in the jejuotomy of the small intestine. Two feeding methods: a percutaneous endoscopic gastrostomy PEG tube, and you can see how that's placed in. So with 9, formulas are what the doctor orders, the type of formula, the amount to give, when to give tube feedings. A nurse gives formula through the feeding tube. Formula is given at room temperature. Tube feedings are given at certain times. Scheduled feedings, intermittent feedings, are over a 24-hour period. Continuous feedings, and they are given by feeding pump. Most formulas contain protein, carbohydrates, fat, vitamins, and minerals. Cold fluids can cause cramping, Open formula can remain at room temperature for at least 8 hours. Microbes can grow in warm formula. Intermittent means to start, stop, and then start again. In scheduled feedings, usually 8 to 12 ounces, 40 to 360 milliliters is given over about 30 minutes. With continuous feedings, formula drips into the feeding tube at a certain rate per minute. A pump is used. The person receives a certain amount every hour. Report immediately any nausea, discomfort during the feeding, vomiting, distended abdomen, coughing, complaints of indigestion or heartburn, redness, swelling, drainage, odor, or pain at the ostomy site. Ostomy means opening, the open site. Diarrhea, constipation, delayed stomach emptying, and aspirations are at risk, and they also need to be reported. Continue to report immediately any fever, signs and symptoms of respiratory distress, increased pulse rate, complaints of flatiness, which you know is flatus, gas, or diarrhea. Also, constipation, again, delayed stomach emptying and aspiration are at risk. Aspiration is a major risk from tube feedings. It can cause pneumonia and death. Aspiration can occur during insertion if the tube moves out of place and from regurgitation. Aspiration is breathing fluid, food, vomitus, or an object into the lungs. During insertion, the tube can slip into the airway. An X-ray is taken after insertion to check tube placement to make sure it is in place. And coughing, sneezing, vomiting, suctioning, and poor positioning are common causes of the tube moving out of place. So when you reposition a person, make sure you reposition carefully. To assist the nurse in preventing regurgitation and aspiration, position the person in a Fowler's or semi-Fowler's position before the feeding. Follow the care plan and the nurse's directions. Maintain the Fowler's or semi-Fowler's position after the feeding. Follow the care plan and the nurse's directions. Avoid the left side lying position. Okay. The RN checks the tube placement before every scheduled tube feeding. This is very important. Comfort measures. Persons with feeding tubes usually are NPO, nothing by mouth. They cannot take anything by mouth. Dry mouth, dry lips, and sore throats can also occur because of the discomfort of the tube feeding. Persons with tube feeding usually are not allowed to eat or drink, NPO. These measures are common. Oral hygiene are given every 2 hours while the person is awake. Lubricant for the lips every 2 hours while the person is awake. Mouth rinses every 2 hours while the person is awake, and secure the tube to the nose. Make sure that the tape is always secured. Tube feedings. You assist the nurse with tube feedings. In some states and centers, nursing assistants give tube feedings and remove NG tubes. Not in Kentucky. You are never responsible for inserting feeding tubes or checking their placement. Never. Parental nutrition. Parental nutrition is given nutrients through a catheter inserted into a vein. This method is used when the person cannot receive and feedings are enteral feedings. The oil or enteral feedings are not enough to keep the person's needs, to meet the person's needs. Risks include infection, fluid imbalances, and blood sugar imbalances. In parental nutrition, a nutrient solution is given directly into the bloodstream through a catheter into a vein. Nutrients do not enter the GI tract. Para means beyond, and intro relates to the bowel. The solution contains water, proteins, carbohydrates, vitamins, and minerals. It drips through a catheter inserted into a large vein. Parental nutrition is often called total parental nutrition, TPN, or hyperalimentation. Hyper means high or excessive. Alimentation means nourishment. Common reasons for TPN include disease, injury, or surgery to the GI tract, severe trauma, infection, or burns, being NPO for more than 5 or 7 days, GI side effects for cancer treatments, prolonged coma, and prolonged anorexia, loss of appetite. Observation to report. You need to report fever, chills, and other signs and symptoms of infection, signs and symptoms of sugar imbalances, chest pain, difficulty breathing, shortness of breath or cough, nausea, vomiting, or diarrhea, and thirst. TPN risks include infection, fluid imbalances, and blood sugar imbalances. Observation to report. Rapid heart rate or irregular heartbeat, weakness and fatigue, sweating, pallor or trembling, confusion or changes in the behavior. Assisting with TPN. The nurse is responsible for all aspects of the TPN. You assist the nurse by carefully observing the person. You assist the nurse with the person's basic needs and activities of daily living. And that's all you have to do with that. The person's receiving TPN may be NPO, meaning they are to receive nothing by mouth. IV therapy. Doctors order IV therapy to provide fluids when they cannot be taken by mouth, replace minerals and vitamins lost because of illness or injury, provide sugar for energy, give drugs and blood. RNs are responsible for the IV therapy. Peripheral and central nervous sites are used. Peripheral sites are all away from the center of the body. Central sites are close to the heart. Okay. Intravenous IV therapy is given fluids through a needle or catheter inserted into a vein. Fluid flows directly into the bloodstream. IV and IV infusion also refer to IV therapy. RNs start and maintain the infusion according to the doctor's orders. RNs also give IV drugs and administer blood. State laws vary about the role of LPNs and LVNs and nursing assistants in IV therapy. For adults, the back of the hand and inner forearm are useful peripheral sites. The subclavian vein and the internal jugular vein are central venous sites. Central venous sites are used for parenteral nutrition, to give large amounts of fluid for long-term IV therapy, and to give drugs that irritate peripheral veins. IV equipment. The solution container is a plastic bag. A catheter or needle is inserted into a vein. The IV tube or infusion tubing connects the IV bag to the catheter or needle. Fluid drips from the bag into the drip chamber. The clamp is used to regulate the flow rate. The IV bag hangs from an IV pole. IV standard or sealing hook. The solution container, a plastic bag, is called the IV bag. A catheter or needle is inserted, of course, into the vein. Flow rate. Number of drops per minute. The RN sets the clamp for the flow rate. RN electrical pump is used to control the flow rate. An alarm sounds off if something is going wrong. If the tube is kinked or whatever, it will alarm for the nurse to come and take care of it. Tell the nurse at once if you hear an alarm going off. It's just very helpful for the nurse. The doctor orders the amount of fluid to give, to infuse, and the amount of time to give it in. With this information, the RN figures the flow rate. The abbreviation drop means drops from the Latin word gutta, meaning drops. Never change the position of the clamp or adjust any controls on IV pumps. You can check the flow rate by counting drops in 1 minute or comparing the drop line with the time line on the time tape. Tell the RN at once if the fluid is dripping, the rate is too fast, or the rate is too slow. To check the flow rate, count the number of drops in 1 minute. The time tape shows how much fluid to give over a period of time. You can look at figure 21:16. For example, the doctor orders 100 milligrams of fluid over 8 hours. The RN marks the tape in 8 one-hour intervals. To check if the infusion is on time, compare the fluid line and the time line on the tape. If the fluid line is above or below the time line, the flow rate is too slow or too fast. Never change. Make sure you never change the position of the clamp or adjust any controls on the IV pumps. Assisting with IV therapy continue. Your state and center may allow you to change dressings at peripheral IV sites. Discontinue a peripheral IV. That's not in Kentucky. You are never responsible for starting and maintaining IV therapy, regulating the flow rate, changing IV bags, giving blood or IV fluids. Never ever. You may help meet the safety, hygiene, and activity needs of a person with IVs. Review the safety measures for IV therapy in box 21 in the textbook. Report at once any of the signs and symptoms of IV therapy complications that are listed in box 21. The quality of life with IV therapy, persons needing nutritional support or IV therapy are often very ill. At all times, you must give quality care and protect the person's rights. Sometimes decisions are made to stop nutritional support or IV therapy. Talk to the nurse if you have problems with the decision. Care needs for persons needing nutritional support or IV therapy may be great and take a lot of time. Do not take shortcuts or omit care. Doing so is unethical. It could also cause great harm. The person or the family, after talking to the doctor, may make the decision to stop nutritional support or IV therapy. They may agree or disagree with such choices. The choice may or may not be within your religion or cultural beliefs and values. The person's or family wishes and doctor's orders must be followed. The person must receive quality care. If you have problems with the decision, the nurse may need to change your assignment. That's the end.